And then the various types of open bite. We're more familiar with the anterior open bite that I've just described, but we're not so familiar with the unilateral open bite, the complete open bite, and the bilateral posterior open bite, as I'll continue from the text. The unilateral open bite, usually seen with a moderate or severe downswing. The tongue is postured laterally, separating the teeth, often seen in conjunction with other patterns. So some of the volume of the tongue is moved out between the teeth, particularly in individuals, of course, who have this tongue between tooth, suckling-like swallowing pattern. We then have the complete open bite. This is usually a class 1 situation, being mild when the tongue covers just the lingual cusps of the molars, and severe when both cusps are covered, disrupting the pattern of interdigitation. This, I think, encapsulates class 1 malocclusion and separates it from ideal occlusion. As the face swings back and down, as the posterior rotation occurs, and the tongue space is reduced and the airway is compromised, the tongue is placed between the teeth, possibly for posture and or for swallowing, and this allows an even, balanced constriction of the dental arches, giving class 1 occlusion. Then, returning to the text, the bilateral posterior open bites, deep bites, as they're more commonly known. The tongue is postured between the molars and often premolars, preventing their eruption, but not the canines or incisors, increasing the freeway space and causing a deep bite, if assessed in the intercuspal position. When biting fully together, the incisors interfere, contacting prematurely, usually distalizing the mandible, encouraging a class 2 division 2 pattern and affecting the temporomandibular joint. Some individuals bite onto these tongue sections, tongue splinting, which leaves marks on the lateral borders of the tongue and increases the depth of bite. This is a very important concept. What I'm saying is that deep bites are actually bilateral posterior open bites, and the individuals gaining deep bites for most of the time hold their mandibles open with the incisors in a normal position. That's their postural position. These are only deep bites because as dentists we ask people to bite their teeth together, and since they don't have a stop in their closure until the molars touch, they only touch when the incisors are crossed over and you have a certain amount of closure, since the molars are held apart by the tongue being in this position, since the tongue has spread laterally at the back of the mouth. And this encapsulates that bilateral posterior open bite with the tongue held backwards. So in this situation, if the tongue is held forwards, we get a bimaxillary protrusion. When we have good muscle tone and usually a closed to often closed lip seal. When we have more of a downswing and the tongue is held more forwards, we get an anterior open bite. Often the lip seal is completely broken. And when the tongue is held backwards, we can get this bilateral posterior open bite. And this can occur even with individuals with quite mild downswings. And in a class 3 situation, the tongue is placed low in the mandible, which is held forwards, in a very similar manner as to the mandibular effect. Being further from the palate, this leads to a collapse in the maxillary arch and the whole maxilla in severe cases. Each variation is dependent on the severity of the swing pattern and the individual's compensatory responses. Certain responses are seen at a group level and may follow genetic predispositions. For example, peoples of Caucasian, Negro or Mongolian descent have a tendency towards class 2 bimaxillary protrusion and class 3 patterns respectively. Consistently steeled lips reduce this downswing, align the anterior teeth and establish a class 1 incisor pattern. High muscular forces tend to widen the anterior craniofacial structure and upright the teeth, even if these are of long-lasting, low forces directed through sections of the tongue placed between the teeth. Now, I understand that was a complex section of the paper that's difficult to get across, and undoubtedly we will re-video this section in a period to make this clearer and expand on an awful lot of complex information placed in a few words. Thank you very much.